Hello and welcome to Pisgah Health Today. My name is Angela Owen and it is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals who are committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Michelle Pilon. Michelle is the CEO and CNO of Transylvania Regional Hospital. Her career began with bedside nursing, which continues to reinforce her commitment to the excellence in the healthcare profession, and she has over 10 years of leadership experience in the world of healthcare. Michelle, welcome to our program today.
Thank you. Thank you. I'd like to thank the Pisgah Health Foundation for inviting me as a guest to speak on the program.
Well, Michelle, we know that there at the hospital, you all have done a lot to help us be ready to face what this world is going through right now with the COVID-19 crisis. Can you tell us what are you doing to protect and keep the hospital safe as well as our community? What preparations have you taken?
We've been preparing and taking action since mid-March. Transylvania Regional is part of the HCA family, and so they've provided us with very good best practices and resources. Some of the strategies that we've employed, first and foremost, we limited access to the hospital. We didn't want the extra traffic through the hospital, possibly exposing our patients or our staff, our caregivers. So that was first. And then we looked at how do we keep our employees safe, because they need to take care of patients. So we've allowed them to wear masking. We have universal masking. It started with the employees. So if a employee is in a patient care area, they are required to wear a mask. That protects them and it protects the patient as well. For non-patient care areas, if they leave their area and they cannot maintain the social distancing, which all of us know about, the 6 feet of space between people, they too are required to wear a mask. We've just recently started masking patients. So when patients come in for outpatient testing, be it an x-ray or a lab, they are masked, they are screened, and they are masked. And then when they arrive at their destination for testing, they're able to take the mask off. One of the things that I failed to mention is one of the earlier strategies, along with limiting access points, was to screen. We started by screening our patients, asking a series of questions regarding symptoms. Have they been short of breath or having chest discomfort, running a temperature? Have they been in areas across the country that are known COVID hotspots? Have they been exposed to someone that they know has the coronavirus? Those were our screening questions. If they answered yes to any of those, they were not able to work. They were encouraged to see their primary care physician and then sent home to be quarantined for 14 days. We have since started taking temperatures of employees and screening employees as well. And so the same, if an employee is running a temp that's 100 degrees or higher, they are not allowed to work, and we immediately put them in touch if they have additional symptoms. The same symptoms that I just mentioned, cough, shortness of breath, they are immediately put in touch with physicians via a telehealth platform. iPad, cell phone, they're actually talking to a provider who screens them, and then they notify our occupational health, our employee health department, and they are sent home for 7 to 14 days. So limiting access, screening our patients, screening employees keeps everyone safe. We're providing scrubs for employees that care for COVID positive patients or what we call PUIs, or patients under investigation. Those are patients that have been tested and they are awaiting their test results. Those scrubs are then turned in at the end of the shift, so employees can wear what they wore in, which are their own clothes, and they don't take anything home to their family, anything that they may have been exposed to. So that's something that we're offering to our employees as well. We've also been very, very cognizant of the amount of personal protective equipment that is being utilized. We have a very, very robust process of reconciliation, locating protective equipment, personal protective equipment in a centralized location. It's counted throughout the day. This allows us to be able to have that on hand to protect staff and protect patients should we get a patient surge. So we're looking at that. We're also, I mentioned patient surge, we're also preparing for an influx of patients. Thus far, North Carolina has been pretty flat on the curve. Everyone's heard about flattening that curve. North Carolina as a state has been pretty flat. We've been pretty flat in Western North Carolina, but you never know. We may have a patient surge, and so we've been planning for how do we handle that? How do we handle that in our emergency department? How do we handle that in our inpatient unit? How do we handle it from a critical care standpoint? From a resource standpoint, if we have to put people on ventilators, do we have enough ventilators to be able to handle that? So all of that has been in the works and has been refined so that we are able to take care of patients when we get a lot of patients at any given time, and we've got a lot of our beds occupied. The last thing I'd like to talk about is the collaboration that's taken place between the hospital and the county. It's been a very, very important collaboration with the health department, Transylvania County Manager, the emergency manager for Transylvania County. And our work has been primarily with how do we handle a surge? If the hospital becomes saturated with patients, where do we put those patients? And so that collaboration has been very, very powerful. It's also developed relationships that will be very beneficial in the future once we are hopefully over this pandemic crisis. So I think that will be very fruitful in the end. So we want people to know that the county and the hospital are working together to protect the community and to be able to handle a crisis. We also want people to know, yes, stay at home first and foremost. That's important. You don't want to expose other people. If you have the virus, you may have the virus and you don't even know it. And you don't want to expose yourself to other people that may have the virus. But if you are sick and you need to come to the hospital is a safe place to be. So do not be afraid to come to the hospital. We are prepared.
Michelle, I cannot say thank you enough for the layers. You went through so many layers of protection and the screening and the masking, all those different things, and the collaboration. You highlight in that collaboration one of the things that I believe on the other side of this, we're going to look back and say, you know, it wasn't a fun time, but these are some of the benefits that we see in the long term. So thank you to you and the entire staff at HCA and Transylvania Regional Hospital for all that you're doing to help keep us safe. We greatly appreciate it and your time and being with us today.
Thank you very much. Once again, I'd like to thank the foundation for allowing me to be a guest, and we are happy to serve the community in any way that we can.
Wonderful. Well, we also want to continue to thank Wildflower Media for their technical and creative support. As Michelle has mentioned, the Pisgah Health Foundation, the Physicians Roundtable, the staff, the board there at Pisgah Health Foundation for their continued just work in rising to the challenges of the community. Should you want to reach out to them, you can email them at info@pisgahhealthfoundation.org. We want to thank our viewers and listeners again for taking time to watch these little information videos and invite you, please stay tuned as we bring more information to help keep you and your family healthy, safe, and well. Stay well, everyone. Thank you.